Something happened to Americans in the 1990s that led to a much higher incidence of hypertension among healthy adults than in prior decades. However, it subsequently stabilized in the 2000s and 2010s. Hi, my name is Andrew Rule. I'm a professor of medicine and nephrologist at the Mayo Clinic. The article I'm presenting is entitled Trends in the Incidence of Hypertension Among Healthy Adults Across 6 Decades, that will be published in the May 2025 issue of Mayo Clinic Proceedings. The onset of hypertension among healthy adults was much lower in the 1960s, 70s, and 80s than it is today. Sometime in the 1990s, there was an increase in the incidence of hypertension that we were able to detect by studying the incidence of hypertension over the past 6 decades. The reason for this increase, based on our analysis, was not related to the common risk factors such as obesity and family history that are known to lead to hypertension, but to something else that we weren't able to measure. It may be something related to changes in the American diet or less exercise, a more sedentary lifestyle. To put this into perspective, the risk of developing a blood pressure greater than 140/90 in the next 20 years for a healthy adult was about 25% before 1990 and about 35% after 1990. So how does this relate to clinical practice? Well, one of the findings we also had in the study was that over the past 6 decades, and this was fairly consistent at each era, only about half of adults were having their hypertension treated with antihypertensive medications. During that 20-year window, we followed them for onset of hypertension. And we required them to have elevated blood pressure readings on 2 different occasions, which were on average about 2 years apart. So these patients clearly had hypertension, yet half or so went untreated. And this just highlights the challenges we have in ensuring our patients receive treatments for their high blood pressure in a timely manner, and they understand the benefits of this treatment, particularly as hypertension is asymptomatic. However, treatment will prevent cardiovascular events, kidney disease, and early mortality. For patients, I think this finding has importance for public health policy. There's a lot of changes in our culture and environment that occur over time. And we have a methodology we developed that allows us to look across multiple decades and see new onsets of diseases, in this case, hypertension, and when they occur and whether or not they can be explained by the known risk factors. And it's very possible that there's been changes related to more processed foods, less physical activity, and perhaps other factors that have led to more hypertension in recent decades. In the future, we hope to take these data and compare them to matched living kidney donors in order to understand whether living kidney donation itself can lead to a higher risk of hypertension compared to individuals who do not donate a kidney. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.